Now to Ohio and the COVID-19 pandemic. Each and every day, it seems like we have so much to unpack.
All right, so here are three headlines from today that you need to know about. Number one, Johnson & Johnson made a push for a booster shot of its COVID-19 vaccine. Number two, Governor Mike DeWine says hospitalizations in Ohio for COVID-19 are breaking records. And this as number three, the mask mandate debate in schools intensifies, leading local school boards and security to meetings. And we're going to bring you team coverage of those issues.
But first, let's look at where we stand right now with case numbers here in Ohio. Our 14-day moving average shows that drop. That line is starting to plateau. You see it there. And as we mentioned, Johnson & Johnson says new studies confirm its single-shot vaccine provides strong protection against serious illness and death, even after 6 months. That includes protection from the Delta variant. Johnson & Johnson is also developing a booster shot. The company says if that shot is given 6 months after the first one, it caused a 12-fold increase in the antibodies we need to fight the virus. J&J has not yet submitted that data to the FDA.
And Governor DeWine held a statewide address today to talk about the pandemic. The big headline is this: the number of people 39 and younger admitted to Ohio's hospitals with COVID-19 is growing.
This is the highest number of admissions for COVID in this age group during the entire pandemic, even higher than during the winter surge levels when no one, let me point that out, when no one was vaccinated.
Now, it isn't a big change, but we are seeing more evidence that cases have peaked here in the Buckeye State. Now, today's new infections are about 500 less than last Tuesday. The positivity rate is still 13.8%, but that has since leveled off.
There is a way to keep more people out of the hospital from COVID besides getting a vaccine. 10 TV's Kevin Landers explaining the solution tonight and how Ohio State Wexner Medical Center is playing a role. Kevin.
Well, good evening. One solution to give people with mild symptoms of COVID monoclonal antibodies. Today, the Ohio State University Wexner Medical Center expanded its monoclonal antibody infusion clinic by moving it to Ohio East Hospital. OSU says the expansion is the result of an increase in hospitalizations of unvaccinated people sick with COVID. Monoclonal antibodies are given to people who are already sick or who are at risk of getting COVID, like those about 65 years or older, people with asthma, cancer, or those who are pregnant. What's different between an infusion and a vaccine is that the infusion only works for a few weeks, while the vaccine protects for months. One patient received the infusion and called it a miracle.
Yeah, I was really impressed. It was 24 hours, and it was like magic. I was 98% better in 24 hours. And you understand, I'd been in bed and not eating and barely able to function.
There is a decision to make for people who are fully vaccinated, who might be a candidate for both monoclonal antibody infusion and a booster shot, which one they want to go with. It really depends on that situation, how sick you are at the present time.
Now, in order to receive an infusion, you do need a doctor's referral. Like the vaccine, the infusion was designed at the same time, so there's no long-term studies. OSU says it expects monoclonal antibodies clinic to be open for the rest of the year and possibly into the spring as the Delta variant continues to spread. Kevin Landers, 10 TV News.